Welcome to the Egg Whisperer Show, a podcast exclusively designed to create more reproductive health awareness and discuss your fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
Hi, everyone. Thank you for watching me on tonight's Egg Whisperer Show. I'm Dr. Amy, and I may not be your fertility doctor, but it doesn't matter where you live. Tonight's show is on how to best prepare for IVF, which stands for In-vitro Fertilization. You can take the tips that I'm going to teach you on this show and apply them no matter where you live or who your doctor is, so that you can have the best chance for pregnancy and feel really well prepared. If you've watched this show before, you know what number one is as far as how to get and be prepared, and that is to know your diagnosis. And how do you do that? Well, it's really easy. The 5 simple steps. T for tubes, U for uterus, S for sperm, H for hormones, and Y for your genetics. There's no such thing as unexplained. You can't tell me that you're 40 years old and then tell me you have unexplained infertility. You just told me what your explanation is, that you're 40 years old. So you have to be honest with yourself, know your diagnosis, because once you know your diagnosis, you know what that means. Then you can do what's in your control to give yourself the best chance for pregnancy going into your IVF cycle. What? Yeah. There's only so much that's in your control. After that, you have to just let it go. You can't control the quality of your eggs. You can only do your best to be as healthy as possible. Take your supplements, eat right, get good sleep. But at the end of the day, you're either going to have a good egg and sperm combo or you're not. And to obsess over things that you don't have control over, to me, is unhealthy. So I teach my patients these things so that they feel like they've done everything in their power to give themselves the best chance, and they can sit back and know that they truly have. By going through this preparation list, you can then say, I've done my preparation and I have no regrets about what happened during this cycle. Before you even start your cycle, I want you to assemble your team, your fertility team. So that starts with a fertility therapist talking to someone about the process and how you feel emotionally. When you go through IVF, it isn't like a surgery to have your appendix removed, right? No one cries that something happened to their appendix and it was taken out. But when it comes to fertility, it's so personal. It's more than just a simple surgery. It has to do with having a pregnancy and giving love and feeling that love back. So that's why I take this very, very seriously. And I talk to my patients about meeting with a fertility therapist. If you don't already have one, ask your fertility doctor. They're going to have referrals in your area that you can work with, okay? And the other is exercise and eating. Work on your nutrition. Follow a pro-fertility diet or a Mediterranean type diet. And talk to a personal trainer and talk to your doctor too about what is the right exercise regimen for you. Everyone's body size is different. Some people should be exercising and some people shouldn't. So your doctor will know exactly what your body needs and what the right intensity should be. So get an individualized plan and prescription for exercise from your doctor. And then there's acupuncture. I don't acupuncture shame people. I don't make people do it, but I certainly want people to know what the benefits are. What I find is this. My patients who do acupuncture actually recover better. They feel better during treatment. They have less side effects. Whether or not it improves egg quality, I think that anything that makes you feel good about yourself could possibly improve your egg quality. But at the end of the day, physical recovery and emotional health is really important to me. So having another cheerleader on your squad, an acupuncturist, for example, is a great thing if it's something that you have time for and if it's something that you want to do. And then the M in the team is mindfulness and meditation. There are a lot of great mindful and meditation apps out there. Find one that you like and do it. Teach yourself mantras like I do with my patients, like I'm going to be a parent one way or another, and things like that, so that you can, those active thoughts that come into your head, I'm sorry, I should change that. Those passive thoughts that come into your head that make you feel negative and bad about yourself, you have to push them out with active thoughts. So that's really important in order to prepare for your IVF cycle, to have that in place. Let's get to the nuts and bolts. How are you going to know what's going on without being organized? Keep track of your files, keep track of your medication calendar, your receipts, have emergency phone numbers on hand, know who to call in the office. If you have questions, their email address. So you're not wondering, who am I going to call if I have a question? When you have that question, know who you're going to call ahead of time and bring that binder in at every single visit. Get a scan report from the ultrasounds, put it in that binder, and then ask these questions. Ask your doctor, What protocol are you going to use on me and why? There's so many different ways of doing an IVF cycle. And you want to know why your doctor is doing that. Why are you using birth control pills? Why aren't you using birth control pills? Why are you using this dose of medications for me? Okay. So know that going in and be a part of the plan. So ask your doctor about, maybe I heard this might be better for that. And what do you think about this? So you feel like it's a conversation and not just a one-sided situation. The other question is, what is your follicle count and how are your estrogen levels rising during the cycle? That's really important for you to know because at some point, and I tell my patients this, every IVF cycle is a learning experience. And there comes a point where I say, you know what? I don't think this is the right cycle for us. And we learned it in the beginning. So let's stop, hold on to the meds, and we're going to try again next month. And we're going to do things a little bit differently. So that's what I want you to know going through the cycle. What's your starting egg count? How are the follicles growing? How are my estrogen levels rising? And is this what you expect? Are you happy with what's going on right now? So those are the questions you want to ask as you're going through the cycle. And then the other thing that what you want to do is understand the medication side effects and what to look out for. For example, if you're doing birth control pills, which I call IVF readiness pills, after you take the last pill, did you know that it's normal to get a period? Well, if you didn't know that, you might freak out. I'm like, oh my God, I'm bleeding. Why is this happening to me? That's normal. And as you take the medications, did you know that you can actually get egg white cervical mucus? That's the body's normal response as the estrogen levels go up. And that's the exact same thing that happens when your estrogen levels rise around ovulation. So if you didn't know that that's the normal response, you might also freak out and think you might ovulate. And that's not something that we want to happen in IVF. And so I reassure my patients and I explain to them, look, this is around the time that you're going to get egg white cervical mucus. This is around the time where I want you to stop exercising it and I want you to take it easy. This is the time I think I want you to abstain from sex before the egg retrieval. So ask your doctor those questions. And now you're fully prepared. And now you're going to be even more prepared because you're going to keep listening. Okay. And this may sound really silly, but what are semen collection options? I don't want a sperm emergency. You don't want a sperm emergency. Trust me, no one wants a sperm emergency. And you're probably like, what is a sperm emergency? A sperm emergency is when you expect sperm on the day of the egg retrieval and ejaculation just can't happen because of severe anxiety. So this is what I talk to my patients about. Do you think there's going to be an issue collecting on the day of the egg retrieval? If so, let's freeze some sperm. Just feels better to have some frozen so that on the day of, you're more relaxed and you can produce a sample without any problems. You can collect on site in my practice. You can collect at home in a hotel room. You have so many options. And the time of the semen collection is at the exact same time as the egg retrieval. So while I'm going in with the female partner into the egg retrieval room, the male partner is going into the semen collection room for their part if there is a male partner involved. And then afterwards, the male partner will hang out with my patient that I just did the egg retrieval on for the next 45 minutes until it's time to go home. Sometimes egg retrievals are super early in the morning, 5 in the morning, 5:30, 6 in the morning. So if you're not a morning person, you need to know what time your egg retrieval is going to be so that you can avoid the dreaded sperm emergency. No sperm emergencies. Okay. And the other thing to think about is once you have sperm, should you do ICSI, PICSI, or not at all? So what the heck is ICSI and PICSI? So you guys know this. Every embryo takes an egg cell and a sperm cell. So you have different ways of getting egg and sperm together. You can take an egg and you can put, let's say, 100,000 sperm cells on top, and we call that microdrop. Or you can take a single sperm and inject it into the egg, and that's called ICSI. But there are other different ways of getting the sperm selected. And one of the ways, and it's one thing that I do in my practice, it's called a PICSI dish. It's a small little plate, and you can go to YouTube and put in PICSI dish, and you'll see exactly what I'm talking about, is a way to select higher quality sperm cells. So that's how we do PICSI. So ask your doctor, because what if you were expecting ICSI, you ended up not getting it, and then there's this disconnect, and you end up with no embryos and you're pissed. Don't be that person. Don't have a sperm emergency. Know exactly what procedures are going to happen before you guys walk into the egg retrieval room. And in fact, what I do in my practice is I actually review the order with the patient before we go in. I say, hello, I expect this number of eggs from you today, and we're going to do ICSI with PICSI, and we're going to either insert here, transfer fresh, transfer frozen, do genetic testing. And this is when I expect to give you the updates during the cycle after the retrieval about your embryos. So you want to ask that. When can I hear from you again about the fertilization report? When am I going to know about the embryo quality? Who is going to be calling me? In my office, it's me. I call my patients first thing in the morning. And then the other thing to ask your doctor is, should we genetically test the embryos? Why or why not? Most of my patients choose genetic testing, but it's not for everybody. Talk to your doctor and ask that question. And if it's something that you choose to do and want to do, do it. And then the other thing is, if your doctor does genetic testing, will they allow you to transfer mosaic embryos? Mosaic embryos are embryos that have potentially a genetic abnormality, but still have a 30 to 50% chance or more of resulting in a live, healthy birth. So talk to a genetic counselor once you get your genetic testing report and see what the mosaic embryos with abnormalities are, if that happens to you, and see if it makes sense for you to transfer them or not. But knowing if your doctor will even transfer mosaic embryo, yes or no, is really important first. Because if your doctor wouldn't even transfer mosaic embryo, you want to talk about what that means for you and what you would do in that type of situation. And being prepared around that is something that might make you feel better and more empowered, so that if it does happen to you, you don't feel like you were underprepared and someone didn't tell you exactly what you needed to know before you started your cycle. So now you're doing your egg retrieval and you got 20 eggs. What does that mean? Well, that means you're at higher risk for OHSS. So ask your doctor that. Am I at high risk for OHSS? And if you don't know what that is, talk to your doctor about it. And then ask your doctor, how will I stay safe from it? This is what I do. I ask my patients during their cycle, especially patients who have 10 or more follicles, to hydrate with salty water. Well, not literally salty water, but electrolyte-rich fluid, Powerade, Propel, G2, G0, Gatorade. There's Drip Drop, those electrolyte powder packs, liquid IV, you can put into your water. Stay hydrated. That's really important during the cycle, and it's even important after the egg retrieval. And I also give my patients a medication called bromocriptine every night until their period starts. And you can also use a medication called Femira on the day of the trigger shot to reduce estrogen levels. And lastly, we don't use HCG trigger for patients who have a very high risk for OHSS. So those are my tips and tricks. Ask your doctor about them as well, so that you stay safe if you're at higher risk for OHSS, and find out if you're at higher risk beforehand, so you can do all those things that I just shared with you. Now, you put all this work in, you did your egg retrieval, and now it's time for transfer. How do you prepare? Well, the best way to prepare is to know the following. What's my embryo quality? What are my chances for pregnancy? And then the hardest of all, what am I going to do if it doesn't work? It's so helpful to talk about these things going in, because let's just go through the scenario. Let's say you wanted 2 kids. You had one really strong embryo and one embryo that wasn't strong, and you're 38 years old. Well, you may actually want to consider doing a second cycle before you transferred. So those are the things that I talk through with my patients in something called a post-IVF consult. And we usually do this 2 weeks after the egg retrieval, after we get the genetic testing results back. But if you're planning a fresh transfer, you still want to have this conversation with your doctor. What is the quality of my embryos? Will I have the chance to reach my family size goals if I transfer fresh? So that 2 years down the road, let's say you're 38, now you're 40, you don't want to look back with fertility regret and wish that you had frozen embryos when you still had healthy eggs. Because then if you didn't at least have that conversation with someone, you might get pretty upset that someone didn't talk to you about this or bring this up with you first as an option. So super important to talk to your doctor about before you transfer. The other thing that I do is implantation testing. I think about it as an evite for your embryo transfer party, so to speak. So these are tests that you do before you transfer. They involve taking medications like estrogen and progesterone, and then doing a biopsy on the lining of the uterus. I call it a mock embryo transfer, basically. So it allows me to really understand a woman's cycle and how to approach her transfer protocol and give a woman her personalized embryo transfer window based on her own window of implantation that we learn about through these genetic tests. So now you've done all this stuff. You've watched this show. You're fully prepared. You've read my articles on IVF essentials and how to best prepare for embryo transfer, because I've done that show. And now you are VIP. What is VIP? VIP is you are pregnant with a very important pregnancy. And you're used to people doing all these checks and seeing you all the time and checking your blood. And now all of a sudden you're pregnant and no one wants to do a scan. And it's so strange. You're just not used to that. So what I tell my patients is this: I never take a minute of pregnancy for granted. And I know you can't see anything, especially in the early part of pregnancy. I want to reassure you that you're just like everyone else. in that it's so normal to feel anxious and worried in the first part of pregnancy because you can't follow things the way you can when you're in your IVF cycle. So what I offer my patients is this: in the early part of a pregnancy, I check HCG and progesterone levels. I track them every few days, maybe for 3 blood draws, and then a week later, and then we do an ultrasound early around 6.5 weeks of pregnancy. And then I offer my patients a second ultrasound if they would like until they see their OBGYN. And if you don't want to do that, that's okay too. But a little bit of TLC is definitely needed sometimes in patients who've gone through traumatic fertility treatments and have been on a long road before their successful VIP pregnancy. So that closes out tonight's show. I hope you feel very well prepared for your IVF cycle, and I really hope this show helped. Have a great night.
Thank you so much for listening and making the Egg Whisperer Show a part of your weekly routine. To find show notes and a full transcript for this episode, visit dramy.org and look under the blog tab. While you're there, you can find a link for the Egg Whisperer newsletter, which keeps you in the know about fertility news. You can also find Dr. Amy and the Egg Whisperer Show on YouTube, Instagram, or Facebook. If you'd like to learn even more, Dr. Amy offers classes at the Egg Whisperer School, eggwhispererschool.com, or you can request a consultation on dramy.org. Thank you so much for tuning in and for sharing the Egg Whisperer Show with others. Keep sparkling and have a great day.